Hello everybody and welcome to a Wednesday's Reflexology Wisdom, and this is going to be a little bit different because we have a live client. I'm not in my treatment room, I'm doing a house visit, and we've got a client here who has just had a hip resurfacing. Same sort of procedure that Andy Murray had. And the first thing, I'm so excited about this, the first thing I'm wanting to show you is actually what we can see visually. So let's just focus in, and I'm going to show you how the feet are actually reflecting what has happened as far as the surgery is concerned. You can probably see it already actually. And then we're going to do a few key treatment protocols for somebody that has had a hip replacement so that we can speed the healing. Okay, so you can see we've got masses of bruising all around this area just here. And as we are all aware, the upper leg, the worst bruising, is in a line just here. And as we know, the upper leg, so from knee to hip, is where we have the reflex for the leg and the hip just here. Hip reflex, very, very bruised. We've also got bruising here on the secondary knee reflex. Now, this client's knee is quite swollen because of the surgery. So, absolutely brilliant that we have got all of this bruising. But then if you look further up the leg here, you know, closer to where the actual surgery has been, no bruising whatsoever. And so you're going to be thinking, why on earth have we got bruising here? Or rather a general practitioner would do, or an ordinary nurse would do. But for a reflexologist, we're looking at this thinking, well, this is just absolutely perfect. This is the hip reflex, this is the leg reflex. So actually, why wouldn't we have bruising shown where the reflex corresponds to the body part? So the first area that we're going to focus on for somebody that's had a hip replacement or a hip resurfacing is going to be the adrenal reflexes. And we're going to work these in a bilateral manner. In other words, we're going to work both feet at the same time, and we're just going to do nice, gentle rotations on the adrenal reflexes. And this is because, as you have seen already, there is quite a bit of inflammation, and this will take inflammation down because the adrenals, of course, produce adrenocorticoids, which are anti-inflammatories. So nice piece of work just here. Another reflex that I would be suggesting that would be worked post-surgery, any post-surgery, is the spleen reflex. Spleen, so that we ensure that there isn't going to be any post-surgery infection. Have the body working at its optimum. Now, we'll call this client Jeff. His name isn't Jeff, but we'll call him Jeff just for now for client confidentiality. Now, Jeff, what I'm going to do is work your spleen, but I do want you to tell me if I'm working it a little bit too hard. It's important that you feel what I'm doing, but I don't want it to be painful. Okay? So what we're going to do is spleen reflex located just here, and we're going to do a little light knuckling. Does that feel okay?
Fine.
Fine, good, that's all right then. Now, do you want me to stay at this depth, Jeff, or do you want me to go any firmer?
If going firmer is going to make things better, do firmer.
Firmer? Okay, lovely. What we're after is what I would call a sweet pain, a productive pain. You know, like I tell you what, he's just pulled a fabulous face. We can't show it, of course, again, because this is a real client. So we've got to be, confidential. But I think he's a bit worried about what sweet pain might mean. So Jeff, if you've got a really bad headache and you're rubbing your temples and it feels good, but it also hurts, that's what we're talking about, sweet pain. So is this sweet pain yet or not quite?
Oh, my dentist says I'm really good at taking pain, which is concerning, so you could probably go even further.
Go a bit further in. Okay. So I don't want to, being as you are so fresh out of surgery. So I'm quite happy with what I'm doing here. So I'm rather than just sweeping as well, we're going to do some circles. I mean, you guys can see from the video, I'm not just pushing my knuckle in, I'm also reinforcing it with pressure from my thumb as well. So we are actually working pretty deeply. So actually Jeff's dentist is absolutely correct. He is good at taking a bit of pain. What? He's laughing now. Okay, so that is the spleen. The other area, of course, that I'm going to be wanting to work is the hip and the leg reflex itself. Okay. Now, some of you guys might be thinking to work directly on the bruising is going to be a contraindication. I would be suggesting not so, because actually this is shouting to me, work me. It's a visual clue from the foot representing the body saying something big's going on here, we need some help. So Jeff, most important, I'm only going to work very lightly to start with. Just a little bit of finger pressure along the leg reflex towards the hip. Is that hurting at all or not?
Not at all.
Not at all. Okay, that's fine. Okay, so now actually, if anything, does it feel as if it's almost anaesthetised, or can you actually feel what I'm doing?
I can feel what you're doing.
You can feel, that's excellent, that's fine. Again, that question that I'm asking about anaesthetised is that if you've got a reflex area and there's absolutely no reaction for your client, that actually says that there is a lack of essential energy in that area, and therefore you want to give extra attention to it. It's probably, in my book, it's the worst reaction you can get, because nothing's happening. And in a live body, you want stuff happening. So I'm just going to gently work this area here. I'm not going to put on any more pressure than I am doing so at the moment. Oh, that's a nice chime. It's almost like Big Ben. You never know what's going to happen when you do a house visit. Right, so now what we're going to do is we're going to actually work on the hip box itself. So this is kind of like the site of where the operation is. I'm also going to work the anatomical cross reflex area to where the hip joint itself is. So first of all, we're going to do the hip box. Again, same sort of technique. It's just a little finger hook. I don't need the pressure of a thumb walk. I'm not wanting to do that just yet. Now, a few days hence from now, when the bruising, that's interesting, just felt something, oh yes. Yeah. Now, did you just feel, can you feel a little popping just here, Jeff? Or not really? If you can't...
Really, I'm aware of something, but I wouldn't call it popping. I could just feel your finger. There is a bit of pressure there, but yeah.
Yeah, okay, that's fine. Okay, so we've got a little bit of popping just here. And of course, what we could be feeling is potentially one of the screws that is holding the resurfaced socket area of your new hip. So He's looking all sort of, oh my goodness, with this. So let's just carry on here. Carry on here. Just a nice medium to light finger hooking pressure. I have to say you're now then you Jeff has just gone like this, so
it was okay, but I was feeling it. Yeah,
you're feeling it. Excellent.
But it was okay.
Just there.
Yeah, probably a little bit further up as well. But
bit further up.
Yeah, so it was all right. Yeah.
More here, or is it? Have I lost it?
No. I'm just feeling it.
It is all around. Okay, fine. All around there. Right.
There. Yeah, I've got it there.
There.
Yeah.
Excellent. So we're going to hold this, and we're just going to wait until it goes off. So, little circles, just holding this. Now, one little tip that I would say, the majority of clients that I see, the majority of clients that you guys probably see are probably going to be women. If a bloke says, oh yeah, just a little bit, normally it would be, oh yes, I can really feel that, is actually what they're supposed to be saying, because blokes are very, very good at dismissing pain, about trying to be the man, if I can put it like that. So if you do get a guy that says, oh yeah, I can feel that, they really can. So do adapt your pressure accordingly. Okay, now has that dissipated at all, Jeff?
I'm not sure, can't tell.
No, you can't tell?
Yeah.
Okay, fair enough. It's another typical sort of bloke reaction there.
But it's not bothering me.
It's not bothering you anymore. There we go. So it has dissipated. Okay.
I just got used to it.
You've got used to it, no.
Well, perhaps he's unbolted the bolt.
Did you hear that? Unbolted the bolt? I don't think so. I hope there actually aren't any bolts in here, but there we go. Now, what we're going to do now, being as we've got to this point of the hip, we're actually going to work the cross referral joint itself. So what I'm going to do is I'm going to do a slight rotation. Now, is that okay to just do a rotation?
No problem at all.
That actually feels all right. This will actually just doing an ankle rotation like this will actually help a little bit with lymph return, because we're stretching the gastrocnemius just here as we push up this way, and as we pull back towards us, we're stretching the tibialis anterior, and the activation of these muscles will actually help with lymphatic return, which of course is going to be great for the swelling that we've got in Jeff's ankle here. Lastly, what we're going to do, I am going to do a thumb. Am I all right to just lift slightly just like that?
Yeah.
Okay, we've got the thumbs up, that's good. Always make sure that we've got client comfort when it when we've got somebody that is post-surgery like this. So I'm now going to be working what you guys will be aware of as the fallopian reflex. I'm only going to do it up until the midway point, but this is also that cross referral area for the hip. And so as I'm going very slowly, I'm doing an ankle rotation at the same time. Hardly any pressure with my thumb, but this is going to really help activate.
In the area there, just one down
you could feel something.
Just in one thumb go low, just feel something, but it was only feeling, yeah.
That's good. So this is exactly the sort of response we want. Tell me what, yes? Okay, yeah, I've just got the thumbs up, so I'm on it. So what I'm going to do, just going to hold my thumb here, very lightly. I'm not pushing into the joint, I can just feel the bones underneath my thumb here. So I'm not actually going into the joint itself, and rotating as we're doing this. Does that feel okay, Jeff?
Fine.
It's perfect, not too hard?
No, it's perfect.
You're absolutely sure?
Positive.
Okay, so do not want, if there's any pain, you must stop me immediately. And this is very important. Some people have commented on it before in my treatments that I do. It has to be interactive with the client, especially in a situation like this where we're post-operative. That it's the client that's leading the treatment, not me, just happily going along and doing what I want to do Really does need to be client focused. Now, has that dissipated? You're not so aware of it anymore?
I'm aware of it. I'm aware of it. I can feel your thumb there, if that makes sense.
But does it feel, extra like it did when you're going, oh yes, I can feel something there?
It's probably dissipated a bit because
I'm getting used. That's perfect. So that's what we would call balancing nicely. Right, I'm going to do one more line. Okay. And it'd be interesting if Jeff doesn't stop me.
Okay, well, you're getting a point. See, I can feel more there again.
You can feel more here, but is it as much as you felt the first time?
I'd actually say probably. Oh, you've gone backwards.
Yes.
It was probably a little bit more, actually.
A little bit more.
It wasn't painful.
No, that's fine. But it's not painful.
No.
Good. So just round about here?
Yeah.
Excellent. We're just going to keep doing that then. Just felt a little bit of give just then.
Yeah, I'd say it's on the pain thing, but it's not anywhere near somewhere I would call discomfortable.
No, that's fine.
That's
but just wanting
quite sharp there.
Quite sharp. Oh,
yeah.
Right. Okay. Thank you.
I'm sorry. You can still do it. It wasn't bothering me.
I'm just being very careful, being as you're just a few days out of surgery. And that's the thing, guys. You want to see your client regularly. Each time you see them, there will be slightly less in the way of reactions as you travel their healing journey with them. But also, post-surgery, you don't want to be giving too lengthy a treatment either. The body has just been through a lot, and so 4, maybe 5 reflexes and maybe 10-15 minute treatment, including opening and closing relaxation, is the order of the day. Now, the final technique I'm going to do is going to be doing lymphatic drainage. Okay, so the final technique that I'm going to do on Jeff here is what I call a snowplow technique. So it literally is just gently activating the lymphatic glands to help with the flow of fluid to be returned to his body. Again, very, very, very light because we're working on inflamed tissue here. But again, it's a case of don't be frightened to do this work. If you work lightly, and if you work in conjunction with your clients, so they're giving you feedback all of the time, this is not going to do any harm. This is going to do less harm than the client walking with a pair of shoes on. If you think about it, with the pressure that I'm putting, this is less pressure than their shoes are going to have. And when I'm in this area here, the tongue of the shoe is going to be gripping their ankle so that the shoe doesn't fall off more than I am. Does that make sense? So don't be frightened. Right, so we're going to do the same on the other foot. And you can see well, you might actually not be able to see with the camera angle. Unfortunately, I can't get the camera over at this angle, but this foot is the normal size. The other foot has got quite a bit of swelling on it. And of course, the focus of what we're wanting to do here, speed the healing and also help with the inflammation. There we go, we're into our 15 minutes of the treatment, so we know that that has been about the right amount of time. So guys, I hope you've enjoyed watching this treatment. Real treatment on a real client with a real condition, and I hope it's been informative. So until I see you next time, stay well, stay safe, and thanks very much for watching.